All right. So we are live. Good afternoon, everybody. Good afternoon, Dr. Laskin. Great to see you. Appreciate you taking the time. Hey, everyone. This is Rolando with Zyris. And as part of our series, we're here with Dr. Bryan Laskin. He's another one of our longtime good friends, also really knowledgeable dentist in the space. We've been talking a lot, and so many things are happening. And what we're going to be doing is spending a little bit of time here to get Dr. Laskin's perspective on a lot of things. In addition to being the owner and running his dental practice in Minnetonka, he's also a small business owner. He's the inventor and driving Opera DDS and Opera VR, as well as a bunch of other platforms we may get into. Dr. Laskin is also the Chief Innovation Officer for Dental Care Alliance. So I guess, first of all, welcome. Thank you for taking the time, and really appreciate you spending this with us.
Oh, thank you very much for having me. I'm a big fan, as you know, of Zyris, and not just what you guys do, but how you do it. It's really you're a great asset to the profession. So thanks for having me.
Awesome. So I'm going to start out by, you know, since I guess dentistry, everything you've seen so far is that everything's shutting down. You're probably not that busy, or are you? How is it going with you, and what's up there?
Well, I guess it's surreal. I am sort of lucky or cursed to be involved in many things, like you said. There's several companies that I'm part of, and the dental practice is shut down. There's we're seeing emergencies, and we're doing some really neat things, I think, around seeing emergencies now. But other parts of my business are just taking off, exploding. We've had a teledentistry application for a couple of years that everybody really thought was cool but didn't quite understand, and they're getting up to speed really quick now. Teledentistry has really come to the forefront of how we triage today. I've been kind of beating that drum for a couple of years, but now the timeline between when we were there to when everybody else got there got compressed due to this crisis.
So when you look at it, it's interesting. It seems you're right. I saw some all sorts of feedback and information about how, with the advent of quote unquote our new normal, how do you see this affecting dentistry? I mean, beyond just teledentistry, there's a lot of talk about, when to go to the dentist, all that type of stuff, especially given all the issues. How do you see this kind of moving forward and turning into our new normal?
Well, I think all of us feel like we were playing chess, and then somebody came and wiped all the pieces off our board, right? And so we're kind of figuring out what exactly, which is how you said, like what's going to happen here. And the way I've kind of look at it is that there's going to be a societal shift, and it will include dentistry, not just dentistry, but it will obviously include us too. And right now, I'm telling my team, like, this is not the time to be mediocre. This is the time to really, really crank. Not just getting a lot of work done. Obviously, the practice isn't that busy, but there is things to prepare for on the other end of this, and that's not going to just happen. You have to set yourself up for success beyond this, however long that may be. There's things that you can do during this time to be wildly productive and get things done. So I think specifically, I do think that teledentistry is going to be here to stay. I don't think things were going that direction. For somebody like me that's a nerd that loves technology, it's a great time because like I said, the people are they're taking the time, they're recognizing the value of leveraging technology for your practice right now, and I think that's going to really accelerate things. We have had to sort of like hold ourselves back because we've been too far ahead of the market sometimes, and now it's like, oh, now we can jump ahead a little, a couple steps and bring some different tools to dentistry. And just if you look historically, based on what's happened with other AIDS epidemic, the financial crises, after a crisis like this, people are much more apt to change than previously. Like on my podcast, which thanks for being on that, that on a future episode. But we talk about burying the dinosaurs in dentistry because I feel like dentistry is 50 years behind where it should be, and probably 100 years behind where it could be, frankly. And unfortunately, this crisis has happened, and we're going through it, and we will get through it to the other side. That's a big piece is just recognize that this is a short period of time. Even if it lasts for 6 months, it's a short period of time. And so when we get on the other end of this, there's going to be people just in general are much more likely to embrace new things than they were previously. And for somebody like myself that's leveraging exponential technologies, emerging technologies, it's exciting because people are more apt to embrace what we're doing.
That's so cool, and it's interesting when you mention it takes events like this to kind of give us a little poke in the butt to say, oh, wait a minute, let's go on. As far as patients are concerned, what should we be saying to them? Or there are a lot of people who are now. Do you see people getting scared to go to the dentist because of oh my goodness, spreading and germs and all that type of stuff?
Well, great point. I think the key is to say something to people. Don't hibernate, bury your head in the sand, and wait for this to pass over. Over communicate, not just with your patients, but with your teams. Right? Everybody's feeling. There's so much uncertainty, which is the best breeding grounds for anxiety, both for patients and teams. Right? And so, communicating, being reassuring, letting people know that you're here for them. There probably will be some people that do have anxiety about coming in. So make sure to reassure them about our sterilization practices and that we treat everybody as if they're infected. And so, and if you have done extra sterilization protocols or whatever you're doing, make sure to not keep it quiet. Communicate it and keep consistently communicating with people. I think this is not the time this is the time to not be sending out messages to your patients. Over communicate, push them to your social media channels and be very active there, because there is going to be another side of this, and you don't want them to sort of kind of forget that you want to be top of mind and also be reassure people, because we need not just because it's good for your business, but let's face it, people just need reassurance at this time too. People need calm voices of reason to listen to.
Awesome. I love the advice, especially regarding the context of social media. Because think about it, everybody's home, so everybody is on. And it's that. What kinds of messages do you see, or what do you think is important to get out there? In addition to over communicate, what are some of the key things that you feel are really important to get to them, to get to your vendors, to get to the team, all that type of stuff? What are some of those things that you feel are really important?
That we're here for you. Like if you have a dental emergency, we are not. I mean, we can't neglect our patients. And part of being neglectful, I believe, at this time would be not telling them that you're here for them, because they probably don't know that. If you sent them a message saying we're closed, right, they may think that you're not there, right? So and if you are closed and you're not seeing emergencies, at least tell them how they can get emergency service. I do think that at this time you should be messaging about your sterilization protocols. Most people don't communicate that stuff on the front end, so now would definitely be the time to be talking about it for sure. Those are the big things, and then I think just updates. Even if you have nothing to say, just checking in, almost, especially with your team. Like we don't know when we're going to open, but having regular meetings where you touch base and just kind of see how everybody's doing is vitally important. You don't need to have an agenda to touch base with somebody.
I love that. You don't need to have an agenda to touch base, especially since we're not seeing each other on a regular basis anymore, it sounds like.
Yeah, video chatting is. We had a meeting on Monday for my technology team, and half the people didn't have their cameras on. I'm like, that flew 2 weeks ago, but now no, we've got to be able to have face-to-face communication. That's to some degree, whatever we can, right?
Yeah, that's awesome. That's awesome. So when you mentioned emergency procedures, what kind of emergency procedures are you currently dealing with and treating right now? You specifically in your practice?
Well, me specifically is nothing. There's another dentist here who's handling all the emergencies, and I think that's a dentist. what's an emergency and how to deal with it is dentist by dentist. She's doing a phenomenal job upstairs taking care of our patients, and I think that that's a personal dentist choice to decide what's an emergency or not. I should mention though too that oftentimes we have an assistant, a front desk person, and a dentist, but we typically have 4 dentists going at all times, and an oral surgeon and an orthodontist. We're a very busy practice. For a smaller practice, you might not be open every day from 9 to 1 seeing emergencies like my office, and you might not have the team member that's there. I've got to mention that like using an Isolite in those instances is perfect. I've worked many times without an assistant using an Isolite, and not just for having it's sort of like an extra set of hands, but also you're evacuating that aerosols, which is incredibly important at this time too, right?
When you say evacuating the aerosols, I see that. Expand on that a little bit with regard to, especially in emergencies.
Yeah, you probably know more than I do about it, but when you have the Isolite wrapping around the area, the contaminated area where you have a handpiece going, it's sucking all those aerosols down the high-speed suction when you have them going out into the operatory. And I've seen some studies where they compare like Isolite uh, to a rubber dam for isolation and things, and they always talk about the reduction in aerosols. And I am not a that's not my area of expertise, but I do know that at this time when there's you want to reduce the aerosols. That's I've seen how they if you are seeing patients, if they have like a peri emergency, I've read to not use an ultrasonic right now and things like that. If you are creating aerosols, I think having something to reduce the amount like an Isolite is a phenomenal idea.
Oh, I appreciate that. Thank you for that. So shifting gears slightly, there are a lot of young dentists right now, or young practices, that are individual, single owner, or single practices, or even with groups. And how do you see this, or what advice would you give those folks who are starting to the anxiety, freaking out about, oh my goodness, am I going to make it through this?
Yeah, that's those are there. So two separate issues. Are you going to make it through this? Right? There's SBA loans and payroll pass and like two what was it $2 trillion in efforts that got passed yesterday. So I do think that there's going to be tons of aid for small businesses like dental practices. Although that's not my area of expert, like lending and getting loans and is one thing. I think where my brain goes to is the opportunity on the other end. This is also in 2008, which is kind of the last economic crisis that I lived through. I ended up buying a practice that was the same size as mine, buying the building that I'm in right now, which is a 3-story building. I bought the lot where my house is. I like pushed all my poker chips in because I was like, either we're sliding into the abyss, or on the other end of this, there's gonna be another end, this is the time to act. And I feel that way now. I feel that if you have the means to if you to go all in right now, I'm certainly looking for companies to purchase and things like that right now, because I feel like on the other end of this, there's going to be a lot of people who are over leveraged, who are thinking that the sunshine was always going, like the economy was always going up into the right, at a very high rate. Well, those people right now are on sale, and so that's kind of where my brain is at. Like on the other end of this, where's the world going to be? Right? Where's the dental world going to be? It's definitely going to be more consumerist, right? It's going to be that's going to be even that was a macro trend that was going to be, I believe, that will be faster now. The merging of medicine and dentistry, right, with a virus like this, that's going to be huge, right? There's going to be tons of companies on sale, or practices, frankly, on sale. There's going to be a lot of dentists who planned on retiring in 6 months that aren't retiring anymore, right?
Right.
If I had a practice, this would be the time I'd be watching. I haven't really been looking at it, but I would guess that lagging here, there'll be some commercial real estate that'll be good opportunity to buy a practice at very low rates, things like that. I mean, I'm a pathological optimist, so I think I'm always looking for the like what's the possibility, like what in every problem there's an opportunity, and there's I believe that in times of crisis like this is when fortunes are made, and this is a horrible epidemic. But the economic response to it, I believe, regardless of how long it lasts, it's going to be an overcorrection in a lot of ways, I believe. And if not, like I said, we're all going to be in a trench together, right? So I'm looking at what's happening, and I went, okay, now's the times to take the poker chips that I have over here and shove them in.
I love the perspective. I love the perspective that because there's adversity, there's always going to be. I guess one of the things is you hear that in a crisis, we're in a crisis, but the perspective you have is when, I use this, I joke, like, you smell that. That's opportunity. When there's crisis, there's opportunity to do things. And the position or the perspective you have is really refreshing, and really, really very much appreciate the sentiment around it, as well as the way to look at that. I think that's important. I've spoken to a lot of dentists who are definitely having a lot of anxiety because I think the uncertainty is the biggest issue that people are facing. How do you what advice would you give regarding that uncertainty?
Well, I'm wired to thrive on change, just in general. So I'm probably uncertainty doesn't give me as much anxiety. Of course, though, just what's going on with the world, the surrealness of what's going on gives me anxiety. But so what I would say is that, that uncertainty really existed 2 weeks ago, right? Whether or not the certainty that you had was a falsehood, right? So and I think we're all understanding that that's the case. But if you look back, what's happened historically after these types of crises, and kind of how people are reacting, some of that will give some, I think, maybe make people feel better, because if you look at what happened historically, this is the first time we've had this specific type of crisis, but crises happen all the time, unfortunately. Every 8 to 20 years or whatever, and so we're going through, and now it's no fun. That's true, but the world's been through them, and we'll continue to go through them on a cycle, and we'll just, the way I look at it is that this isn't really that abnormal of a thing. If you look at it at what epidemiologists have been predicting this for years and years, luckily this isn't the type of virus that most people die from. I mean, so there's a lot of positives, but maybe the best advice I can say is just not to watch the news, because every time I turn on the news, I too want to crawl up in the corner and start crying, right? So I avoid the news more than the coronavirus, I think.
No, you're right. It's I forget. I was talking. There's like this ticker, and it's just showing. And if you were just to watch that, you'd kind of freak out and think to yourself, "But wait a minute, mortality rates aren't that high." So, thank you for that. I love that perspective too.
Well, it's horrible, right? I mean, it's horrible what's going on. But the news makes it like it makes you feel it, like, breaking news. Yeah, and breaking news. There's another 100 cases in Iowa, or it's like, yeah, it's really bad. But we all can control. There's a lot that we can control, right? And I think trying to stay positive, or as much as possible, and looking for opportunity where you can, I think is going to it's going to keep you sane in times of uncertainty like this.
Well, and especially for people like me, I'm going to just speak to myself. Sanity is good.
Have you found it? Just kidding.
I'm looking. Although I am eating like a fiend, because it's right there, because I'm working from home, and all I'm finding is I'm just consuming food. So
yeah, me too.
So shifting gears slightly, you said the whole context of communication is really important. Upper DDS, that does that too, correct? There's a context around it.
Oh yeah, I think Opera DDS really is the most comprehensive communication platform in dentistry. We started off with team chat, so messaging between team members. which I believe is what provides quality care. Good communication equals quality care uh, in a lot of ways. But then we added HIPAA compliant email, digital case collaboration. We do full recall with text, email, postcard reminders. Um, we have just the best kick-ass online forms, like textable forms in the industry by far. It's a very broad platform. And we also have a teledentistry application, which right now is exploding. We're really, because when you can't see patients, it's really important to be able to see what's going on. That's always been the case, but right now, because the several state boards are pushing teledentistry and saying this is how you should evaluate people, not instead of just having them come in and possibly, infecting everybody, have them send video or still images, which is what we do in Opera DDS. Yep. And then and right now, just a few days ago, I think it was on Friday of last week, 7 of the insurance companies now cover a teledentistry exam as they would if the person was in your office. And so the two
So like
codes.
with a phone?
Yep. So if they take a picture of their tooth and you see them and do a procedure down the road, you have to bill. Here's the codes: D9996 and D9995. The 9995 is for synchronous communication. So if you do like a video chat, like what we're doing right now, and 6 is for asynchronous communication, which is what I recommend. I don't want to talk to my patients I don't even talk to my wife when I'm out of town via video chat. I sure as hell don't want to talk to my patients who are emotional via video chat, right? So so either one though, but you have to combine it with a different, like a code, like a diagnostic code, like the 04140 limited exam. So insurance companies several insurance companies are now covering that as if you saw the patient in the office for the exam, which I think is great, and I think that'll hopefully continue because it makes sense for everybody, including insurance companies. Because if I see you have a broken tooth, I can have you come in and do the crown versus having come in the office, say, "Oh, you need a crown. Can you come back in 2 weeks?" It's moronic, right? So there's much more to it than that. But in this moment of crisis, being able to triage emergencies through teledentistry is huge, and it's gone from a feature that we've had for a couple of years that everybody was interested in, but people didn't really leverage that much. To now, it's like we had like 15 offices sign up yesterday because they need that like now, right?
That's so incredible. And, as I'm thinking through it, I mean, a lot of times you're right. It could save a trip because it's like, hey, doctor, take the picture. You look at it. You go, oh yeah, come in. Or no, you're good. You can come back. So love the message. And what was it? It was Dean. What were those codes again? Just to repeat.
Oh, so it's D9995 and D9996.
Okay, very good. That's great to hear. The other thing, and we spoke briefly about, is like you're doing with us, education. Education sounds like a really, you'd mentioned that to me when we were talking before, how important. You've also got another platform that you use. There are lots of different platforms to do that. Thoughts on education?
Yeah, I think education is vitally important. And right now, at this point in time, if you aren't seeing patients, it's a great time to get caught up on education and get your CEs and everything else. The education that we provide, or I provide, within a relatively new platform that we launched called Upgrade Dental. It's upgradedental.com.
Right?
Yeah, exactly. It's really, I felt like there's a lot of confusion in the technology space. And I felt like a lot of dentists don't have the time. Now you can't even go to the conventions and shop around 12 different CAD CAM systems or CT imaging or digital x-rays. And so what I try to do is provide clarity, explain how we got to this. Well, first of all, we have a timeline of every technology that's available in dentistry in the order which you should implement them. And then for each one, we talk about how we got to this point with this technology, what it is, why it matters, how to evaluate technology, and then how to implement it. And then I give a specific recommendation for every for every technology. I don't take money from any of the companies. I just think that there's a lack of, some people are trying to be too wishy-washy and be like, Switzerland. I think it's important for, I love Switzerland, by the way. It's one of my favorite countries. So that was rude to say, but which is great. But when it comes to selecting technology in dentistry, I think a lot of dentists need the clarity of somebody say, hey, I've kicked the tires. I've done, I've used it all, and this is what I recommend. And that's what I try to do. Am I always right? Absolutely not. But I think in all of these technologies, I've probably looked at it and more closely than 99.9% of the dentists will, and I certainly have I have some inside information into a lot of, as you know, like with just being involved in technology and dentistry on a deep level for the last 20 years. It's really just, I just imagine dentists are busy and they don't have the time to figure out like, what should I buy? So we're trying to provide that clarity. And then we also reach out to those vendors and say, hey, if you want to help out the Upgrade Dental members, would you give us the best deal you can? And of course, they're like, yes. And so
Yeah,
it's great.
That's such a great, I love the perspective, because especially now, catching up on your CE is one thing, but also catching up on understanding technology, because technology it's moving very quickly. So especially when clinicians, dentists, DAs, hygienists, you name it, any of the clinicians in the industry are looking for information. The message that you have, which is take the time now, not only to get your CE, but also learn about all this cool stuff that's going on, and this, because it's effectively going to be the future. Teledentistry, I love the context around that too. That was very, very, very really helpful. So,
well, I like to say, who's the most reliable employee you have?
Go ahead.
It's the technology in your office. Your recall system, like if you use Opera DDS, it's sending out messages to your patients while you're sleeping, right? That Isolite, that if your assistant can't come in and you have to see an emergency patient, that Isolite's there for you, right? I mean, there's so many ways to leverage technology that I think dentists, they don't think it all the way through sometimes. Like paperless forms, over 80% of offices use paper. Like,
Yeah.
I can't even get my hair cut for $8 and fill out a paper form, because they understand it's not worth their time. And you've got like your front office person who acts like they're an octopus doing 12 things at once, and you want them to scan and shred. And I mean, I tell dentists, do me a favor. When you go back to when your office is open, or maybe now's the perfect time, when that emergency patient comes in, you process their forms, right? Just one. You will switch to paperless forms so bad. But the amount of wasted, mind-numbing, laborious work that goes on in the average dental practice. We have these talented individuals, and we're giving them just the crappiest of crap work to do, right? Let's sorry, you got me on my soapbox. I think that
No.
Technology is way under leveraged in the average dental practice, in a lot of different ways. And that's really what I feel like my mission is to bring us up to speed with the rest of the world. The rest of the world, technology is going super fast, and we're plugging along like a snail. And I think that that's dangerous. I think that that's what has led to companies like Smile Direct Club, or things being sold in Target and Walmart that should be sold through our dental practices. Is because we haven't adapted as an industry to what consumers are looking for. And that's a big part of what I want to do.
Yeah, I have to echo the best saying ever: technology is the best employee. I absolutely love that. That's one of our team, Dr. Binti. I love that. I think that's hilarious. So, thank you for taking the time. Your perspective, the kind of the, it's the reassuring message you're giving is, what, we're going to get through this, and yes, deal with what you're dealing with now. Over communicate, do it well. That's an important message that I'm hearing very clearly from you. But also make sure that you're looking at your business, your livelihood, and putting things in place forward. Did I kind of sum that up correctly?
I agree. I mean, I think right now all of our etch a sketches are being shaken, right? So we kind of have the opportunity to look and design a new picture when we're on the other side of this, right? And that is an opportunity that every practice, every business, everybody has. And so we don't know what the other end of this is going to look like, but we'll get there, right? And I think when your chess pieces are on the floor, when you can design where you want to put them when the game's back on, and I think this is the time to do that.
Thank you. Thank you so much. Thank you for your time. Thank you for your insight. I love the context around technology. What are you doing now when you're at home, or are you still
I'm
just
not
way
at
too
home.
busy?
I'm the only one in my office, and I am incredibly busy. We're doing a lot. There's going to be a lot of technology that gets born out of this crisis. I can tell you that from our end for sure.
Excellent. Well, take care. Please be safe. Appreciate you taking the time. And I know that your site is on. Upper DDS is there. You can find you, Dr. Laskin. It's been a pleasure. Look forward to seeing you at some point, and if not, virtually seeing you and spending more time with you.
Yeah, hopefully, sometime there'll be some dental show that will go on this year that I can see at.
Okay.
Thanks a
Have
lot.
a wonderful rest of your week.